a few things that they wanted to be attended to. The health monitoring units, they were looking at salaries, they were looking at supplies and increase in budget allocation as well, which has been dealt with. So today, this morning, we want to put that more into perspective. The increase of the budget allocation to the health ministry or the health sector, what does that mean for the hospitals and us, the people that go to the hospitals? And we have the executive, acting director, Kirudu Hospital, Dr. Charles Kabulgo, with us this morning. Doctor, good morning. Thank you for allowing us to interfere your morning a bit this morning.
Good morning, David.
So we want to understand 2.6 trillion Uganda shillings allocated to the health sector, your sector. What does that mean for you here in the hospital? What does that mean? Does that mean better services, better more pills, or more buildings, or more beds? We need to put that more into perspective.
Good morning, listeners. Kabulgo Charles is my name, Acting Director, Kirudu Hospital. Indeed, we are glad that the Minister of Health has increased the budget for health. As rightly said, what will this translate to? As rightly said in your introduction that a couple of months ago, the doctors went on strike for the reason that they needed better the service conditions. This included an increment in their salaries, and this was achieved. I must say that I'm very grateful to government that they were able to fulfill their pledge regarding the service, regarding their increase in salaries. What do I mean? That a medical officer who was earning 800,000 now is working out with 2.5 million. That is quite a very big leap, and we're very grateful to government. And for us as leaders, as people who are leading our colleagues, it's important for us now to say, well, government has fulfilled its part of its pledge regarding our increments. Let's also pay back to the people. Let's improve. Let's avoid absenteeism, as my president, Dr. Buko, one time mentioned. 2, increase in the salary, in the budget for health is also going to translate into better medicines. As rightly said, last year, Kirudu was allocated 1.2 billion for medicines. This year, tentatively, I think I've heard that we've been allocated about 4.5 billion. That's a very big increase. And this definitely is not money to my pocket, but it's money that is allocated to national medical stores to supply medicine and sundries to our patients. And for us, this is going to change a lot in regarding the way we serve our people. And 2, the increase in, thirdly, the increase in the budget also means that we can have more staff. Remember, one of the reasons the doctors were complaining about is having more people deployed in the. This is a very big gap regarding, let's say, ratios of nurses to patients, ratios of doctors to patients. And Kirudu has been one of the beneficiaries in the current recruitment. We have had, just in this last about 6 months, we've had about more than 300 new health staff recruited for Kirudu Hospital. And those definitely come with a salary. And that is part of the increment in the budget allocation for health.
Okay, so Doctor, for Omuntu Wawansi, the day-to-day person that is going to come to the hospital today, usually when they say there has been an increment of this sort, people are expecting a change. Yes. So for the person that is going to come to this hospital today or tomorrow, what change should they be expecting from the hospital?
Like I mentioned before, we definitely expect that we're going to have, we're going to reduce on the number of, because previously we've had patients coming in, we diagnose you with an illness, and we recommend a particular illness. But out of probably the 5 medicines that we recommend, maybe we have only 2 or 3. So then you have to go and look for the other, the remaining. So we think the fraction of drugs that people have got to seek for outside the health setting is going to reduce. It may not go to 0, but it's going to reduce, which for me is going to be a less burden on both the patients and their service providers. So that is mainly the difference that is going to happen. Like Kirudu, as for Kirudu, we know that one of the areas that takes our biggest budget is, let's say, the dialysis unit, because the consumables are quite very expensive, and we're lucky that they've allocated some money onto that. It's not going to completely take away a small expenditure on part of the patient, but it's going to reduce the percentage the patient has been putting in to be able to access these services. And we're sure that we promise that that is definitely going to happen. For the other simple ailments like antibiotics and all the other things, those definitely are going to change drastically. But we already noticed that even before, the prescriptions that were going outside the hospital had greatly improved because of improvements in the budgeting that had happened.
Earlier on, we were talking about the doctors and the medical officers at the hospital and that salary increment. What does that mean to them? Because we all know having people that are working under you that are disgruntled about their salary is not good. But what does that mean for you as a head and to the people that are getting this increment?
Thank you. Of course, we know that one of the motivating factors is salaries. Not alone salary, but it's one of the factors that motivates people, because you want to leave home when you've been able to pay your electricity bills, your kids are in a good school and all the other things. So we know that one of the incentives that government has given to the health workers is a salary increment. So I expect better service delivery from my colleagues. Like I think you heard from the Dr. Buku, the Uganda Medical Association president, that they mentioned that the time is now for us now, the health workers, to pay back. Government has fulfilled its part of the pledge. There's been an increase, not what we desired, but it's much, much better than what it was. So I think as health workers, we definitely now need to be more responsive, fight absenteeism. That's one thing that we're really trying to fight. We're also trying to address the issue of attitude. Previously, people were saying, you go to a healthcare setting, you work for 1 hour and walk away. We're trying to fight that attitude so that health workers are more available in the health units. I'm glad to say, like for us in Kirudu, people are more available. We have not had many issues of absenteeism. We've had other issues that we're trying to address, but the issue of absenteeism is really not to that magnitude like I've had in other hospitals. So I think with this increment in the salary, things are even going to get better. One thing that we pride about as Kirudu is that you can never come to Kirudu and fail to find a health worker to attend to you. That is one thing that I know. We've been blamed for many other reasons, but there is always a health worker to attend to you. For factors that are within our control, we usually try to address them. So availability of health workers is one thing that we've really tried to address as managers of the hospital.
Okay. You mentioned Uganda Medical Association and the fact that you had a whole list of demands during that strike. I highlighted them at the beginning. Health monitoring unit, salary, supplies, increase the budget allocation, workforce. It looks like nearly 80% of this has been fulfilled. But the question now remains is, yes, it's time for you to pay back. But for how long are you going to pay back before you ask for the remaining 20 or 30%?
Well, it's difficult for me to predict that, but I'm sure now, because ideally is that when you look at a salary should be, is it able to help you survive? It's, money is difficult to say I've now got a salary where I'm 100% comfortable. But it's about trying to meet your demands, your needs of the day. So I think that with this salary increment, especially I'm not saying we are there 100%. And I know there are some cadres that have not whose names have not yet been addressed. But I know it's a process which our government is addressing. And with that in mind, I don't think we're going to have another strike very soon. Okay. We also, one of the demands, as you mentioned, was the issue of supplies, the medicines and supplies. That has drastically improved. Like you mentioned, Kirudu got 1.2 billion last year. This time it's getting 4-point-something billion. And that is definitely going to help a lot.
Okay. Doctor, on our way here, we were listening to KFM, and Brian and Maritza were having a very interesting conversation, and it was about national medical insurance. Is it time for us to now get into that space? Because we have been slightly having that discussion on insurance and medical insurance in this country, and how the log is so much on that day-to-day Ugandan to make sure that he's kept healthy. What's your take on that?
Yeah, I'm one person who's really advocating for the national health insurance to come into play. One, because the spectrum of diseases has drastically changed, that it's very difficult for government to continue footing the bill, the medical bill of Ugandans on its own. Patients or Ugandans should be able to, on some way, save some money, specifically addressed, prepared for health. Because the way the system is right now, if you look at expenditure, out-of-pocket expenditure contributes the biggest percentage on the health budget, then followed by, of course, government supplement on that. So many people come to hospitals very late because they don't have the money to spend. So they're waiting for a relative to contribute, people to send money from abroad so they can come to hospital, which in actual sense makes the management of the condition extremely difficult, because you've taken a lot of time to report to the health center and the disease has become more complicated, so the care that you need is more complicated. And right now, as you may know very well, that non-communicable diseases are on the increase. They are very difficult to manage, and they are going to be on the increase. There's no doubt about that. That's why we're advocating for to do things that are going to reduce on that burden. But with that in mind, we really need to see that funds should be available to cater for these illnesses, for diabetes, hypertension. These are long-term, you're on treatment for a long time. So we really need health insurance to come into place, and this, I think, should supplement the Ministry of Health or the government allocation on the budget.
Last question, Doctor. You mentioned that you have had an increase in supplies from 1.2 billion to nearly 4-point-something billion. That means you're going to have more supplies. Yes. But that doesn't take away the case of theft when it comes to these supplies. Yeah. How is that going to be dealt with?
Yes, and I'm sure you must have followed the story that was in the news recently, where some health workers were found wanting into their service delivery. You know, you can never 100% have angels, because these are part of the community that we live in. But gradually we're trying to weed out this. I'm sure when you walked in, you must have realized a very robust security system at our gate. Every car that comes in and gets out of the hospital is checked. We have security cameras. So those who have attempted to take out any supplies from the hospital have definitely got arrested. Also, you must have heard that, unfortunately, I really sympathize with the family that we recently lost one of our colleagues who was reported on the BBC story that was covered, where he had been in contact. I had contacted him before his demise, and he was the whistleblower. He was the person when contacted by those undercover reporters. He called the police in Katwe and called the RCS of Machindi and said that I have been contacted by people who want to buy drugs. Can you please deploy? So if you look at the video very critically, when they came to Chirudu, there were people who were in plain clothes surrounding the vehicles. Those were police officers that had been deployed. Unfortunately, that part of the story was not covered, and this guy felt that he had been a whistleblower who wanted to protect government property, but unfortunately in the story he was portrayed as a thief. I think that burdened on him too much. Police is investigating the case. I don't want to comment on that, but we're trying to investigate what exactly happened. But what we know, he is the one who blew the lead over the whole story. Because someone comes and contacts you, says, I want to buy drugs, government drugs moreover. He lured them into here. He called the police in Chibuye. The police deploys plainclothes security men. Unfortunately, before the deal goes through, they disappear. So, but where they were going, because there was evidence that they had wanted to buy drugs, they were arrested.
Okay. Thank you very much, Dr. Charles Kabogo, the acting director of Chirudu Hospital. He has highlighted that over 60% of their demands as the association have been met, and this includes salary, supplies, increase in budget allocation, and of course workforce. So for the ordinary Ugandan out there, I think you should expect, like the doctor has said himself, that now it is upon the doctors to make sure that they pay back to the government and the people of Uganda as well with better services. So if you're coming to Chirudu Hospital today or you had blacklisted it on the places to go, please don't. Come and expect better services. This morning we have stretched our Kickstarter conversation a little bit because we wanted to get the details into perspective what that big allocation to our medical friends here means for us, the ordinary Ugandans. Are we getting better services? And by the look of things, yes, we are. Let me hand you back to Rita and Mala, who will take you through the rest of the show. And then, of course, if you have any feedback, please come to our social media platforms. The hashtag is morning@NTV.
Well, thank you so much, David. One thing that definitely a number of people who are watching, and you and I, Mala, are definitely going to take from that conversation is when he mentions that now we should expect them to be giving us much more. And trust me, the public does hold accountable each and every person who promises. Now, a number of people believing, what more do we expect them to now do?
Maybe the issue of drug stockouts, like he mentioned, will be sorted out. Service delivery will be on another level. Especially, he also did point out to the investigative that was done by BBC, and he said that this time around things are going to get better. But it's unfortunate that one of the people who were exposed in that story took their lives, committed suicide, and so so in case you missed that story, by the way, you can grab it so you can get to understand what's happening in the health sector and why this conversation at Morning at NTV was critical, especially with the critical health sector, health center, that being Chirudu Hospital. And David did do it justice.
Yes, he did.
We have the answers now.
I hope you do. Now that you can be able to use the hashtag Morning at NTV, do you feel that the answers, your questions have been answered? Were they sufficient? And now, who are you going to be holding accountable? Plus, have you perhaps gained more hope when it comes to the government health facilities? Because now you can be able to get there, telling you they'll be the right. When it comes to the drugs, they're right there. When it comes to the doctors, they will be present and they will attend to you.
Right, so keep your views coming. The hashtag is Morning at NTV. We are now bringing this to a wrap, but before we do so, we'd like to bring you up to speed with the latest developments. Now, at least 6 street children have lost their lives. They died after a perimeter wall on Lohanan High School pretty much collapsed along Namirembe Road. 2 have so far been rushed to Mulago Hospital for treatment, and police are have already begun their investigations into the same. Of course, we'll bring you the updates as they continue to unfold, but at this point in time we have to say goodbye.
Have yourselves a great start to the week, and may you be able to, one, achieve your limitless bit of things. You are limitless. Step out, and for whatever might come your way, remember to sometimes shut out the negative energy, the negative vibes, and focus on what you have to do for the week. I hope you have a plan for the week, by the way. Or you're planning on going, okay, Monday is done, Tuesday is done. Try and get a plan for the week. It helps you see where you have come by the end of Friday. What have you achieved? Because at the end of this week, we'll be getting into the 7th month of 2019. That was quick.
So for me, Malaki Villa, Odera, and Rita Kanya, goodbye. Make it work. See you. Bye.
You're watching Morning at NTV.